Hi, Jill Charbonneau, President of the Vermont State Labor Council AFL-CIO.
Good morning, this is Dave Hills. I am a longtime healthcare consultant, and we're here at another edition of the Kitchen Table Talk for Senate Bill S53.
Universal access to primary care. Now, universal access to primary care, publicly funded. This bill has arrived at House Appropriations, and it's going to once again need the support of everyday Vermonters to let Montpelier know that universal access to primary care is important to us.
In Vermont, those folks that visit an emergency department and are sent home, in other words, they're not admitted to the hospital, represent nearly 90% of all visits that go to the emergency room. Now, that doesn't mean that all 90% of those don't need to go to the emergency room. For example, if I've broken an arm, I need to go to the emergency room, have it set, but I'm not going to get admitted to the hospital for a broken arm. That's just one example. What we want to look at is a key percentage of those diagnoses which could have been seen by either primary care or urgent care, shifting those visits to a much lower costing healthcare environment. And these have big ramifications on costs of not only the consumer for their healthcare premiums, but also on the hospital for providing those services. In turn, the hospital doesn't need to charge so much, can reduce their staffing and their supplies. This then allows the insurance companies to reduce their costs to pay the hospital for those. And so you have costs on both sides, the consumer, the hospital, and the insurance companies, and it becomes a cycle. Now let's talk about the costs of these visits. When you talk about an average cost of an emergency room visit, estimates range anywhere from about $500 to $3,000. And if you talk about those people that could have gone to the doctor instead of going to the emergency room, you're talking about $700 or $800 per emergency room visit on an average, and about $175, $200 for an urgent care or a primary care visit. Okay, so we're talking about a difference of conservatively $500 in savings that is passed down first to the consumer, second to the hospital, and thirdly to the insurance company, which then saves again to the consumer. So now let's talk about overall impact on an annual basis. Using that $500 savings number, never mind the multiplication of it, we have a population of 28% of all ED visits, which is about 250,000 visits a year in Vermont to the emergency room. Take 28% of that, and that gives us about 87,600 visits a year that we can move out of the emergency department. When we take that number and multiply it times the $500 in savings, again, a single multiplier, we get a number of close to $45 million a year. And that's just starting the process. So then we really start talking about what do we need to do to save that money. Again, it's S53, allowing better access to primary care and urgent care in Vermont.
S53, thanks to the grassroots efforts of people like you, has made its way from House Health to House Appropriations. And shortly thereafter, it will be on the floor of the Vermont House of Representatives. I ask you today to contact your own personal member in the legislature and ask them to support S53, Universal Access to Primary Care, to the Appropriations Committee, and then to vote for it on the floor. And after that, hopefully we'll be making a video asking you to contact Governor Scott. Thank you.